Hey everybody, thanks for tuning in. I'm making a series of videos to go with my new column at Healthing.ca, which is a brand new project from the National Post, and sometimes picked up by 140 of its affiliates across the country. So this menopause chick is really grateful and excited that we are elevating the conversation around perimenopause, menopause, and women's midlife health. My commentary today, it has to do with my third piece on Healthing.ca, which I wrote the night, like right after the Oscars broadcast, because something really sparked this idea inside me, and it happened from the stage while the Oscars were talking about the movie Frozen, and they had many countries and nationalities represented, with all the different Elsas on stage, and then made a joke about healthcare in Canada being free. Essentially, it was the Canadian Elsa is the same as everyone else, except healthcare is free. And everyone laughed. And I understand that because, I mean, it's one of the great things that Canada is known for. But what I wanted to bring to the healthing conversation was that women's midlife health is really not all that free. And it's one of the things that keeps me awake at night, because I talk to thousands of women in the Menopause Chicks private online community who are making limited health decisions based on limited resources. And that might be limited financial resources, it might be limited or a lack of employer health benefits or extended health benefits. And the reality is that I'm not sure who else is laying awake at night thinking about this. And here's what I mean by that. We can go to our GP and we can see our GP. We can get a prescription often for birth control pills or sleeping pills or antidepressants. And we're really often not out of pocket for that experience. But if a woman wants to be proactive with her health, let's say she wants to see a pelvic floor physiotherapist to prevent incontinence, to prevent prolapse, to respond to pain with sex, that is not always covered. And if a woman wants to see a naturopath, unless she has the financial resources or the health benefits to do so, that is not covered by our healthcare system. And so it becomes limiting, and it separates us into two camps. It means women's midlife health belongs to women who have resources, and it doesn't necessarily belong to or apply to women who don't. And so this is something that we're talking about an awful lot lately with the healthcare professionals that Menopause Chicks is working with, because I don't know. I don't believe that the system is too big to change. I do believe that we are the system, and the first thing that we need to do is to speak up and to bring awareness to this and to understand the end game. The end game is that midlife women hold up the world. We're the mothers, the daughters, we're going to work, we're taking care of people in the community, we're looking after aging parents. And if no one is thinking about how we need to be taken care of, then all of those things can fall by the wayside. And so by prioritizing women's midlife health, we have this huge opportunity, like could be the single biggest thing we can do to improve the health of the world is to take care of women in midlife. And so I'm pretty passionate about that. So I wrote the column. It got great response. Thank you so much to everyone who reacted and commented. A couple of people mistook the column for me pinning Canadian healthcare against U.S. healthcare in the U.S. No, the point was missed there. That was not what the column was about at all. I was merely picking up on the joke that had been made about healthcare in Canada being free, and I wanted to point out that it is not free. And in fact, we have a lot of people, women in midlife included, but a lot of people making limited health decisions based on what is covered. And I understand that that's a mentality and it's also a reality. But we have heads of households who are deciding on a monthly basis whether or not they should put brakes on their car or go see a naturopath and take care of their hormone health. And for some reason, we haven't brought that conversation to the forefront. So that's what I was trying to do in my column. If you'd like to read it, you can go to Healthing.ca, just Google menopause or Shirley Weir, and you will see all of my columns there. And I'll talk to you next.